I think the first thing is it's experience and training. With my practice, the bulk of what I do are surgical procedures. And the training that you go through as a plastic surgeon is very specific, and it's regulated by an independent third party. So it's not a group of doctors protecting their own turf and just looking after themselves. It's regulated by an independent body that's overseen by the government. So I think in the first instance you need to have gone through a training regime that gives you the tools to deal with the potential eventualities. So there's all sorts of outcomes that can occur, and so it's very difficult to sort of say that the risks are only A, B and C. There could be others as well that are rare or unpredictable that you still need to be aware of. And I think that the training that you go through as a plastic surgeon helps immeasurably to get those things in order. The analogy, I don't know if this is a great one, but the analogy that has been used, is that of, if everything's going to plan, when you're flying a plane, it's really straightforward. The takeoff and the landing, the weather conditions and the light and all that sort of stuff is fine, then that's easy to do. What you want to try and have your pilots trained to do, though, are for those situations where things go wrong, or when things don't go to plan, or there's variables that you haven't foreseen. So that's the importance of the training that we do, and that's why it takes so long. In terms of my own personal practice, I think time is the main thing. I don't think that these things can be rushed. And that goes for each stage of I guess the doctor-patient interaction. It's the pre-op, intra-op, so during the procedure, and the post-op side of things. None of that can be rushed, and I think that's when problems occur, because if things get rushed, things get missed. On a really basic level, it's even if there's just a miscommunication because of a rushed sort of interaction, then that's going to lead to a poor outcome potentially as well. So I think time is really important. And then obviously, the practical side of things, which most doctors will do, maintaining your education, attending conferences, presenting conferences, doing research, interacting with your peers, having trainees. They're all things that I do that help to maintain the technical side of things to make it as safe as possible for my patients.